You turn on the news station to updated facts and statistics of the novel coronavirus, or COVID-19 as it is officially known. But what exactly is the story and science behind this pandemic? How did we get here? And where do we go from here? Explore with me and let's find out in today's episode of the Health Infographics Show. The story begins in the Huanan seafood market in Wuhan, China. Here, the virus is believed to have originated from bats, which then infected pangolins before finally infecting humans. This disease subsequently spread through community transmission, and on January 30th, 2020, the novel coronavirus originating from Wuhan was declared a global health emergency by the World Health Organization. A month and a half later, on March 11, 2020, COVID-19 was upgraded to a global pandemic by the World Health Organization. This virus is especially concerning because of its potent ability to infect human hosts through human-to-human transmission. The virus is thought to transmit via close contact, such as being less than 6 feet or 2 meters apart from others, as well as respiratory droplets. Some experts also believe that transmission can occur from patients who do not have symptoms. As a result, many countries have enacted a mandatory 14-day quarantine or self-isolation policy for individuals who have traveled abroad in order to manage and control the spread of this virus. Common symptoms of COVID-19 include dry cough and shortness of breath. Currently, there is no treatment and only supportive measures such as corticosteroids and oxygen therapy are given by hospitals to treat this disease. Some hospitals are also testing the clinical effectiveness of antiviral drugs such as remdesivir, with some reports of positive effects. However, this study remains in its early stages, and most hospitals do not have access to this drug. Corticosteroids are prescribed to suppress the patient's autoimmune response causing the respiratory distress, while oxygen is delivered to help the patient overcome difficulty breathing and shortness of breath. A person's ability to survive the infection is dependent on the strength of the individual immune system. This is why many elderly and those with a compromised immune system, such as patients with diabetes or cancer, are more likely to die as a result of COVID-19. Currently, the global mortality rate of COVID-19 is approximately 6.5%, which is lower than the SARS coronavirus at 10% and the MERS coronavirus at 34%. However, this does not mean that COVID-19 is less deadly and we should not take this virus seriously. A primary reason for this is that COVID-19 is more infectious than both SARS or MERS. As seen in this graph comparing total infections, there have been significantly more confirmed cases of COVID-19 compared to SARS or MERS. Therefore, despite COVID-19 having a relatively lower mortality rate of 6.5% compared to 10% for SARS and 34% for MERS, more people will die as a result of COVID-19 simply because many more people will become infected. As of the making of this video on April 21st, 2020, there are more than 2.5 million confirmed cases of COVID-19 globally, with over 170,000 deaths associated with this disease. This is significantly more than both SARS and MERS, which had a death rate of 774 and 866, respectively, during the total infection period. To help authorities and our healthcare workers manage this disease, as citizens, we need to practice social distancing. Social distancing is important because it will help flatten the curve and prevent the healthcare infrastructure from collapse due to demand for healthcare service that exceeds capacity supply. There are only so many ICU units, hospital beds, and ventilators in every healthcare system. Therefore, we each have a responsibility to protect the health and safety of ourselves and others during this time, so it's important we take social distancing seriously to minimize the spread of COVID-19 and ensure all those who require healthcare services can access it during this extraordinary time. If you are able to, in addition to social distancing, we can also support local businesses and provide financial support to organizations carrying out essential services, such as hospitals and food banks. Click here to learn more about some of these organizations. Donations made to many of these organizations qualify for federal and provincial tax credits, so it's a win-win. Thank you for taking the time to learn about COVID-19. Please remember to practice social distancing to save lives and help authorities manage the spread of this disease within our communities.